Welcome back, everybody. My name is Dr. Khan Kao. Welcome to my channel again. I'm joined today by my good friend, Dr. Joel Ellison. He's a psychiatrist. We go way, way, way back in med school, and we did a mission trip together in Tanzania, which was outstanding as well. Today, Joel will talk to us regarding psychiatry and if it's a good fit for you. Okay, welcome, Joel.
Thank you. Thanks for having me, Con.
Uh, Thanks for volunteering your time. I know you're a super busy guy with your work and family as well. So I appreciate you doing this for me.
Of course.
Yeah, to start with our first question, briefly describe how long have you been in practice and what's your practice like, and brief description of psychiatry.
Sure. So I've been in, I finished residency training a little over 3 years ago.
Okay.
And residency training is 4 years.
Mm-hmm.
And immediately upon completing residency, I went into a private practice. So I've been doing that now 3+ years. And now my job consists of just seeing patients kind of in my office, doing medication management. I also do psychotherapy, often a combination of both. A handful of people, I just do the medication management, and I either have another therapist or they're stable on their medications. For some people, I just kind of function as their therapist because medications either aren't fully necessary or they have sort of a reticence to go on them, and it remains something that's on the table for their treatment, but it kind of is an ongoing discussion. Additionally, I do medication-assisted treatment for opioid dependence,
Okay.
and I do that an afternoon a week. I've actually been doing that since residency, and I don't know if we get to this coming up, but one of the nice things about psychiatry is that in residency you are not completely overwhelmed in terms of the demands, so it does offer the opportunity to do additional work outside of residency responsibilities. I mean, granted, if you're meeting your responsibilities in the residency program, but I was able to begin doing Suboxone treatment along with some hospital-based work in residency, and have continued that into my own practice.
Okay, it's great to know that there's a residency out there that's essentially gives you free time to do things that you also want to do as well.
Mm-hmm.
I remember just my free time was just wanting to go to sleep.
Yeah, that is, at least in my experience, was a nice part about my residency training.
That's awesome. Did you always knew that you wanted to be a psychiatrist, or did you also consider other specialties?
I went into medical school, telling myself I was keeping an open mind, but at the time and in retrospect, the one thing that I really wanted to do was become a psychiatrist.
Mm-hmm.
I kept an open mind, or at least told people I was keeping an open mind, so they didn't write me off when I was rotating. Not that anybody really would have done that.
Yeah.
I enjoyed pediatrics. I enjoyed family medicine. I enjoyed emergency medicine, neurology.
Mm-hmm.
So those are things I think I could have been happy doing, but ultimately didn't want to do in the same way I wanted to do psychiatry.
Okay. So what do you think is the most exciting aspect about psychiatry or your job in general?
So, my venue of practice is different from a hospital-based practice or an emergency psychiatry practice. So speaking directly about doing outpatient psychiatry, the way I do it is I get to make my practice exactly what I wanted. So one of the things that was really important to me, even going back to medical school, something that, or heading into medical school, something that really drew me to it was the ability to do psychotherapy. Having the ability to meet with people once a week, sometimes more, sometimes every other week, whatever it might be, and sort of get into the details of their life and what it is what it's like to be them,
Yeah.
and help them kind of navigate various conflicts they're having sort of internally in relationships, just in areas of life that they might be struggling, to be able to be involved and helpful with that is something I really enjoy doing. It's rewarding, and
Hmm.
it's kind of a manner of connecting with people that isn't it's very unique.
Yeah. Yeah. So on the other end of the spectrum, was there anything you dislike about psychiatry or want to change?
I think the things that I wouldn't say I dislike
Mhm.
anything really. I mean, there are frustrating things. It's a
Yeah.
it is still a job, so you're going to be met by frustrations, things that are kind of outside of your control.
Hmm.
Um, so kind of to expect that it's going to be smooth sailing all the way is, you might want to reconsider that.
Yeah.
But like getting medications approved, finding cost-effective treatments for people that don't have insurance,
Hmm.
accessing resources can be difficult, um, either because of cost or just they're not readily available. Um,
Yeah.
I mean, more sort of systems-based things
Yeah.
are what I find frustrating.
Yeah.
Um, that's what I would say to
Okay.
that.
Yeah, and it seems like in other specialties they come that I've interviewed as that's also a problematic issue as well. As you mean in the emergency uh, medicine aspect, there's a lot of social worker involvement as well
Mhm.
to figure out what's the best way to care for them. That's outside of the medical aspect.
Right.
So I can imagine you guys having difficult times, especially during these times too.
Hmm.
With that, I mean, you kind of already knew that you wanted to go into psychiatry, but uh, for those folks who don't have an inkling of what psychiatry is, do you feel like there is a certain personality or characteristics that would want to go into psychiatry and also make them be a successful psychiatrist?
I think having a curiosity about other people, just
Hmm.
kind of their internal worlds, their day-to-day experiences, the um, sort of difficult things they encounter, the things that sort of excite them or people feel passionate about. I think having a curiosity about that is really important. It's going to make the job enjoyable. It's going to make you better at the job. Um,
Hmm.
and I think this can be said about any medical specialty: being empathetic, being kind.
Hmm.
I think one of the ways in which psychiatry, I guess you could call it, is a little bit behind other subspecialties. Is it we don't have a lot of well-defined um, science around psychiatric disorders,
Hmm.
um, and and the anatomy and physiology of the brain, and say it the way you do of the kidney. Like, it's
Yeah.
pretty well spelled out with the kidney. The brain is, as one of my mentors in training had said, it's like the bottom of the Pacific Ocean.
Hmm.
It's undiscovered. It's kind of, and that's you know where hopefully it will go, is that these things sort of get mapped out, which better informs diagnosis and treatment. So with all of that, I think it's important to be comfortable not fully knowing,
Yeah.
um, and sort of sitting in that space and working with somebody to find out together what exactly is going on, whether it's what's the diagnosis, what might be the
Hmm.
best treatment, what might be the best referral. Say, being able to sit in that space and sort of wait and see, um, getting comfortable with that, I think, is a really important thing for one to do. Um, Other qualities, I think it's helpful to have interests outside of psychiatry. or medicine, because you are talking with people, and
Yeah.
people don't relate in terms of, medical lexicon, or
Hmm.
they have a wide array of interests. So having a having a wide array of interests yourself is going to help you relate to people.
Yeah. I totally agree with that assessment as well. Although I'm no psychiatrist, but it allows me to talk to people in the ER that comes in um, all areas to be able to just talk to them. And
Yeah, I mean, it helps you do your job, because it helps build trust with people,
hmm.
that you can be related to.
My next question is: uh, every specialty has some myths that are unfair or untrue. Do you find that psychiatry have some myths that are unfair to your own specialty?
Yeah, I mean, psychiatrists are known as head shrinkers, and which I think is unfair, or the notion that, like, if I meet someone, say I'm um, meeting somebody sort of as a civilian, and they ask
Hmm.
what I do, and I say I'm a psychiatrist, and it's like, oh, I'm gonna watch what I say around you.
Yeah.
This notion that I'm kind of walking around analyzing people, or that a psychiatrist walks around analyzing people, um, is not true, because when we're off the clock, we're just going about our lives in the same way. You are not triaging every person you meet
Yeah.
as you're walking down the street. Granted, if an emergency happened, you'd be on the spot, but
Yeah.
you're not kind of assessing everybody as you encounter them. In the past, there has been sort of the myth or notion, I don't think necessarily incredibly widespread, but that psychiatry is sort of a pseudoscience, or it's not like a real medical doctor.
Mhm.
But with the science around psychiatry steadily growing, that I don't think that is a fair myth
Mhm.
to carry on. Um, there is some distrust of psychiatrists, I think, in some communities more than others, and based off of practices in psychiatry in the past, I don't necessarily think that's completely unfounded. There were um, a number of practices that weren't based on any evidence,
Mhm.
sort of based on essentially people's whims, um, and have proven ultimately to be more detrimental than they were helpful. Um, so that is sort of a legacy of psychiatry that continues to be, you know, a thing of the past.
Mm. Mm. Okay, thanks for that. Joel, you have a really busy schedule with your work and life. So how have you managed a good work-life balance in psychiatry? And can you describe also typical in other psychiatrists as well?
So for me, being in private practice, I have I'm lucky to be able to set my own hours.
Hmm.
So to sort of find the balance of how much I need to work, how much I want to work, versus how much kind of I need and want to be away from work.
Hmm.
Um, so in starting out in the practice, the goal is to fill it up, to be as busy as you can, and then it's kind of reaching this point at which, okay, I can't do any more. My time is sort of fully allocated as far as work goes.
Hmm.
Um, and then once you reach that point, now it's like it continues to take up your time. So it's really a matter of learning to establish the boundaries of where work stops, where kind of other parts of life begin.
Hmm.
Um, it it's never going to be a sort of rigid line between the two, because being in private practice, sort of on my own, I cover all my patients myself. Um, Unless, of course, I was, say, out of the office for an extended period of time, I might have a colleague cover emergencies for me.
Hmm.
Um, but in that regard, work will bleed into personal life, and um,
Hmm.
but on the other hand, it's not horribly frequent, and when it is,
Yeah.
being people that I'm familiar with, it can be handled a lot more efficiently and with the patient's best interest sort of fully in mind.
Okay.
What other other question?
Yeah, I'm not sure if you can delve into like, are there differences in, mean the academic setting? I know you've been mostly done private settings. Do you think there's much differences?
Yeah, I mean, in the academic setting,
Yeah.
if it's hospital based, you're going to be working during sort of working hours, managing typically an inpatient unit or a
Hmm.
consult liaison team. Um, so it's sort of a 8 to 4, 9 to 5 work schedule, and you'll have rotating call.
Hmm.
In the academic setting, mainly that's going to be backup call because the residents are the ones who are, you know, there on the front line, while the attending is typically available by phone. In emergency psychiatry, it's shift work, much like the medical emergency
Hmm.
department. Um, and in say non-academic but still hospital setting, it's going to be similar. Where you'll have, let's say you're working inpatient, you'll cover your unit or your census for the week, and then there'll
Yeah.
be an on-call attending, seeing everyone over the weekend, and that rotates. Um, in addition, academic psychiatry or hospital-based psychiatry isn't strictly outpatient or inpatient, excuse me, but people have outpatient practices as well.
Hmm.
I think the structure is a little different, where it's more dictated, sort of what you can do by the system, as
Hmm.
opposed to private practice, in which I make the decision how I want to practice. So, as I said, psychotherapy is a big part of what I do,
Yeah.
and that's the way it's structured at this point in time, due to insurance and revenues that departments need to bring in. It is not cost effective for psychiatrists to be doing 45, 50-minute psychotherapy sessions.
Mm. Okay. So you've touched upon how psychiatry has been shaped from the past, but can you briefly touch upon how it has changed over these times during COVID-19? And what do you think in 10 to 20 years will be like if you're a psychiatrist?
So I think in the midst of COVID, there has certainly been, um, and this has been, I think, widely talked about in sort of the general news media as well. Just an increased demand for mental health services. I think
Hmm.
the overall stress of the world right now, the isolation that the pandemic has thrust upon lots of people, has made the demands of psychiatrists, therapists, other mental health professionals even greater. Additionally, the
Hmm.
those who were sort of most at risk in terms of their psychiatric illness or burdens
Hmm.
have really suffered on account of COVID,
Yeah.
because it's just so essential that they have sort of wraparound services that can reach them at any time. And with COVID, there's not just the distance and the need to maintain distance. There's also just a matter of, I think, those resources being spread even thinner. Um, so, COVID certainly has, I think, worsened suffering for people, suffering from mental illness.
Yeah.
Um, but on the other hand, I think that, given in psychiatry, you don't need to do a physical exam. A lot of what's gathered and sort of a lot of what one is formulating, their differential diagnosis on,
Hmm.
um, diagnose these treatment plans is just communication with the patient. And so, just as me and you, Con, are doing now, I can do
Yeah.
with a patient, have a teleconference
Hmm.
for an appointment rather than being face to face. and something is lost, not being sort of in person with someone, but ultimately, even though I had my doubts about it when probably March 17th, when the
Mm-hmm.
whole country shut down,
Yeah.
um, I've been very pleased and surprised at how fluid the transition was, and how not really missing a beat with remote appointments.
Mm-hmm. Do you feel like that it's going to be more tele medicine, tele psychiatry in the future then versus inpatient, in person to person? I mean.
Yeah, I think so, and I think it's already been moving that way, especially in certain areas,
Mm-hmm.
because in more rural or remote areas of the country, there are it is a problem, the lack of psychiatrists. So it was kind of moving in that direction where people who were maybe not in urban, suburban areas would be meeting most likely with somebody remotely via telemedicine. And I think now that pretty much every psychiatrist will have been forced to have had this experience with
Yeah.
telepsychiatry, that it's something that's going to be utilized much, much more, because I think in talking with colleagues, it they're virtually all in agreement that it has been a very reasonable alternative to being in person, which is great because it expands access for people.
Yeah. Yeah. I agree. Uh, this is naive of me. Do you work with mid-levels at all? I know you work with psychologists, therapists, but do you work like with NPs and PAs?
So I personally don't work directly with NPs and PAs.
Mm-hmm.
It is a very common thing.
Mm-hmm.
Something that, say, I could do, I don't do now, but would be sort of an opportunity to have different responsibilities, to diversify practice, would be to um, be the sort of supervising physician for a nurse practitioner. So, I mean, often the way that's set up is there might be a clinic, say a mental health clinic, a clinic that's primarily providing, say, therapy, and they bring in a nurse practitioner
Mm-hmm.
to also prescribe medications for their clients, patients. Um, they would need a psychiatrist to be the supervising physician, to consult on patients, to do chart reviews. So that's an opportunity for a psychiatrist. If you're working in a hospital-based setting, you'll definitely be working with nurse practitioners, PAs, whether on the inpatient units, whether in the emergency room. Um, it is pretty common, and my going back to residency, working with NPs, PAs was always
Okay.
a good experience, and very knowledgeable. And the only difference in their practice is the letters at the end of their names.
Yeah. So what do you think will be the job market for the future students, pre-med and medical students?
I think it'll continue to be good.
Mm-hmm.
As I said, there are really plenty areas of the country in which there are, frankly, a lack of psychiatrists. So in that regard, there will be huge demand, but also the needs will not sort of begin to dwindle. You look at COVID, the needs have expanded, and that they'll always be there. So I think there will always be a demand for psychiatrists. Additionally, maybe we'll get into the different subspecialties or
Mm-hmm.
fellowship trainings available in psychiatry, but as the baby boomers continue to age, the demand for geriatric psychiatrists, of which there are really a lacking, is going to be huge.
Mm-hmm.
So if that was an area of interest, geriatric psychiatry, which is also often a more there's more of a sort of intersection between medicine and psychiatry,
Mm-hmm.
because of just of the greater medical needs of older patients.
Yeah.
So that's a potential area of interest to people. That's going to be a huge need, or
Mm-hmm.
is a huge need, and will only grow
Yeah.
as the population ages.
Yeah. It's the same in the EM. emergency medicine, there's a geriatric fellowship in emergency, or what they call palliative care as well.
Oh,
Uh,
cool. I
it-
didn't know that.
yeah, it's there are a few places that have it.
Mm.
What other career opportunities can you do, fellowship or not fellowship, with psychiatry?
So, as I mentioned, the geriatric
Hmm.
fellowship is one. You can do a child and adolescent psychiatry fellowship. There are
Hmm.
some programs that offer a triple board program, meaning you become board certified in pediatrics, general psychiatry, or what I do is general adult psychiatry, and child and adolescent psychiatry. So you can do that as your 5-year training program, or often what people will do is they'll enter into a general psychiatry training program, which is typically 4 years, and fast track it by foregoing the 4th year of their general psychiatry residency and going into a 2-year fellowship in child and adolescent. There's also addiction psychiatry, and that is done also with an addiction psychiatry fellowship. We'll also have kind of combined with addiction medicine. So you'll have psychiatrists as well as internal medicine, people who would have trained through internal medicine.
Hmm.
Uh, there is a consult liaison fellowship, um, and there might be, what did I say, child, geriatric, consult. You can do, I think there are various training programs that have sort of a further training in women's health.
Mm.
Um, and then there are different areas in which someone can become specialized, whether there's a fellowship or not. Working, whether it's working specifically with people who are in the midst of cancer treatment. Additional training I've done is in psychotherapy. So at the Psychoanalytic Institute in Cincinnati, while I haven't gone through psychoanalytic training, which is sort of a 5-year training program along with your own psychoanalysis. And for those who don't know, psychoanalysis is 3 to 4 times a week
Hmm.
therapy.
Yeah.
So really in depth and intense. So there's training, which involves reading of psychoanalytic literature, sort of starting from Freud and then up until the present,
Hmm.
along with having a handful of psychoanalytic cases that you are the doctor therapist for. So I haven't gone to that extent, but have done some added training in psychotherapy.
Hmm.
And then there are various other sort of seminars you can do along the lines of various modalities of psychotherapy, added trainings with psychopharmacology.
Hmm.
So there's no lack of ways to kind of expand your knowledge base and your sort of focused expertise.
Yeah. Cool. Thank you for that. Uh, are there any additional resources that student can go find out to learn more about psychiatry?
One thing I direct to is psychnews.org is sort of it's a publication put out by the American Psychiatric Association. So it has a lot of articles about upcoming or developing treatments, about different areas or issues around psychiatry, whether it's related to insurance, systems-based stuff, psychiatry and the news, psychiatry and its sort of place in history,
Hmm.
psychiatry and its place in history in relation to what's going on in the world today. So a lot of interesting information. Um, and then I think the best place to get sort of I know what I found most helpful when I was a medical student, the best resource was talking to the people involved in medical education that are
Hmm.
in the psychiatry department. So talking to the director of training for medical students, talking when you're talking to residents in psychiatry at your medical school, just getting a sense of what it's like for them, and what if you think it would be a place that you would fit, because I think that's a really important thing for any residency, psychiatry or otherwise, is do you feel like you fit in there? Is this, in line with the way that you think, the way you think through patients? You just enjoy being around those people? Because, I mean, ultimately, where you're going to spend, you know, 40-50% of your time, you want to enjoy that place, and you want to enjoy those people.
Yeah. So for my last question, do you have any tips or a top tip for students who want to go into psychiatry or learn more about psychiatry? Yeah.
Yeah, I would say just be interested in the world and other people.
Mhm.
I think get in the habit of being self-reflective,
Mhm.
beginning to think about sort of what motivates you, what are the things that kind of can cloud your judgment at times, your own anxieties. I think being sort of attuned to those is a really important part of being a psychiatrist, because we all respond differently to different types of people, and you're going to come across many different types of people as a psychiatrist. So to know what you might be feeling in relation to somebody else
Mhm.
is a really important thing to be able to sort of sort through, in order that it's not clouding your judgment and ability to help somebody to the best of your ability. um, and then just talk to people who are in the field, whether it's therapists, psychiatrists, other doctors, and get a sense of what it's about, and see if it's something you think that might be a good fit for you.
Cool. Thank you for that response. Uh, that's all the questions I have. Was there anything else you'd like to add to this conversation?
Um, no, not unless you think there's anything else.
No, I'm good. Thank you for your time and knowledge, and very much appreciated, Joel.
Yeah, of course. It's good to talk with you, Con.
Yeah, likewise.